Here are 12 life hacks that can help you survive in an emergency situation. When faced with such scenarios, most people rely on advice from friends or family. However, even the most well-known recommendations can sometimes be incorrect or harmful. For instance, did you know that applying ice directly to a bruise might not be the best idea? Or that lifting an unconscious person could lead to severe consequences? Let's explore these life hacks in detail. If you're dealing with a foreign object in your eye, the first thing to remember is not to do anything yourself if it's something serious like a piece of glass. Have someone drive you to the hospital. If it's just an eyelash, start by washing your hands, then locate the eyelash using a mirror. Blinking might help your tears wash it out. Once it's in the corner of your eye, use a wet piece of cloth to remove it. Next, when it comes to applying ointment to a wound, you might want to reconsider. Ointments contain moisture, which can create a breeding ground for bacteria. The best approach is to clean the wound with cool water and soap, and then apply a dry bandage. This method will help the wound heal more quickly. If someone has a fever, avoid rubbing them with alcohol or vinegar. Both substances can be absorbed into the bloodstream, potentially causing intoxication or increasing acidity, which is especially dangerous for children. Instead, encourage them to drink plenty of water and other non-alcoholic fluids. Cooling the room to 61-64 degrees Fahrenheit, 16-18 degrees Celsius, can also help them recover from the fever more comfortably. Lifting up an unconscious person is another common mistake. Doing so could worsen the situation by aggravating any spasms. Instead, you should lift their legs, unbutton any tight clothing, and let them rest. Once they regain consciousness, avoid giving them coffee or energy drinks, as caffeine can lead to dehydration. When treating burns, it's important not to use butter or sour cream. While these might relieve pain initially because they're cold, they also dry out the skin and disrupt thermal exchange, which can push heat deeper into the skin and cause more damage. The better option is to hold the burn under cool water for 15 minutes to alleviate the pain. Remember, blisters form for a reason, to protect the wound from infection. Setting a bone on your own should never be attempted unless you're a professional trauma surgeon. Trying to set a dislocated joint could cause further injury. Instead, immobilize the injured limb and head to the hospital. Bandage the limb in a comfortable position, ensuring that you immobilize not only the area of possible fracture but also the two closest joints. If you have a sprain, applying warmth is not advisable. Heat can increase blood flow, leading to more severe swelling. In the first days after the injury, apply cold to reduce inflammation and pain. Try to limit the use of the injured limb for at least 48 hours. Making yourself vomit in case of poisoning is another widely believed but harmful piece of advice. Inducing vomiting can cause the poison to enter the lungs or, if the poison is a chemical, can result in burning the throat. Additionally, it can be difficult to stop vomiting once it starts, which can lead to dehydration. The best course of action is to call an ambulance as quickly as possible. If you need to rescue a drowning person and you can swim, it's important to approach them from behind to prevent them from dragging you down in their panic. Grab them under the armpits or by the chin and move towards the shore, keeping their head near your belly to keep it above water. Never try to pull objects out of serious wounds. While removing a splinter or small glass shard from your hand is fine, more significant objects should be left in place until medical professionals can handle it. The object might actually be preventing bleeding. The only thing you should do is apply alcohol to the wound, though it will be painful. For serious injuries, seek professional help immediately. Applying ice directly to a bruise is not ideal. You should always place a cloth between your skin and the ice pack to avoid a cold burn. Even with a cloth, you should only apply ice for a maximum of 20 minutes at a time, followed by a 90-minute break. After 48 hours, using ice is no longer beneficial. Finally, while stitches are often necessary to close cuts, skin glue can be a less painful and quicker alternative for smaller wounds. Wash the wound with cold water, stop the bleeding by pressing it, close the edges of the wound, and apply skin glue. However, if the wound is too large, seek professional medical assistance. Please like this video if you found it helpful and share your first aid stories in the comments. Don't forget to share this information with friends to help them know what to do in an emergency, and click subscribe to stay connected with us on the bright side of life.